I think the most amazing thing about LANAP procedure using the laser and treating the gum disease is that it's so minimal in the invasiveness. It's just not invasive at all. And what I've seen with patients coming in postoperatively is basically they all tell me we didn't have any symptoms, there was no problem. I went about doing my daily routine versus where I used to do the surgery the old-fashioned way, basically using a blade and doing the surgery. And basically, patient's healing time is just reduced. And we don't have to worry about postoperative discomfort, there is no swelling, and patient comfort. I think that's the number one thing. I think my patients like it. So patients' feedback has been wonderful. This is the one thing I actually don't mind doing. Because like I said, the old-fashioned way, just cutting the patient open, it was not a good thing to explain to patient. But this has been absolutely no problem. Patients actually love doing this. They're very open-minded to it. They come in. They're actually asking me for it, so that's good. I treated this one patient. She had severe periodontal disease. Before LANAP procedure, I would have probably recommended to extract the teeth because the molars, as you know, they're multi-rooted teeth, and it's very hard to treat periodontally. So patient came in. I said, we have this new procedure. Let's treat you. Let's see what happens. Well, I saw the patient 6 months after, and we basically went in there. The disease process basically was gone. I mean, when I went in there, the teeth were solid. There was no mobility. Mobility has reduced. There was no sign of infection. So the teeth are going to stay. I mean, that is just amazing. That's incredible. Before, I would have had taken the teeth out, get it ready for implants, but at this point, it's just incredible. I'm using it for biostimulation. It's wonderful. Patient comes in. I've used it for aphthous ulcer before. That works pretty good. But mainly biostimulation. Now, with advanced training, when I go back, I'm definitely be using it for a lot more than what I have been using. I've owned a diode laser before. That was my first laser. And then I bought a Waterlase a few years later. They made a lot of promises. So when I bought them, especially the Waterlase, I mean, I spent over $100,000 for that. Basically, it didn't deliver, neither one of them. So I stayed away from buying anything else for years and years until I finally gave in. I said, I got to try the Millennium laser. And here I am. I tried it, and they do work. That's the only thing I can tell you about Millennium right now. It actually has done what they said it does. Compared to Waterlase, training-wise, there wasn't much training there. They gave me an option to go to several courses, but it was just general dentist doing some sort of treatment. I went in there, it was very minimal. It wasn't anything advanced. And like I said, it just didn't do what it was supposed to do. And it just sat there the whole time. But with Millennium, since I've had it, I've been using it just about every day, which is fantastic. I just wish I had bought this before. The other lasers, honestly, I'm behind the times. I wish they had taught us this, in Perio program that I went to. But I'm here. I'm glad I'm here. I mean, this is it. This is the point. But I should have been here much, much earlier.